Hello, everybody. My name is Michelle Wadsworth, and this is my community health promotion presentation with California State University San Marcos, nursing class 370, due October 14th, 2018. So what seems to be the problem? Obesity is what it is. Obesity is beyond epidemic levels in the US, and a community in Birmingham, Alabama reflects that with its high prevalence of obesity stemming from choice of nutrition to lack of exercise and education about healthy lifestyles. A community in Birmingham, Alabama has requested that a group of nurses provide health promotion, health education to a high school class to prevent the cycle from continuing. The school lunch program serves typical Southern cuisine, and although they do have a sports program, an organized physical education program is not part of the curriculum. Michelle Obama's national plan, called Let's Move, supports Millennium Goals of aiming to decrease childhood obesity. Michelle Obama's Let's Move plan sets a goal to decrease childhood obesity to 5% by 2030. Learning needs assessment. Learning needs assessment can be performed by identifying the audience, which in this case would be high school students, tailoring education to provide easy comprehension for all age spectrums from 13 to 18 years of age, determining current levels of activity and meal choices by teenagers throughout the day. Priority needs to promote health would be incorporating at least 1 hour of physical activity at home, daily, at least 5 times a week, teaching students healthy food choices, as well as educating students on the effect of eating healthy and staying active has on their health and their future. Health promotion model. There's the pre-seed and the proceed. The proceed aspect of the model focuses on educational diagnoses of the problem, being very essential before developing and implementing the intervention plan. The proceed focuses on environmental variables or things outside of the individual to one's health. I chose the Pender's health model to implement because unlike the other models, Pender's health promotion model is directed at increasing the level of well-being with special focus on helping clients to associate positive feelings with health-promoting actions. Why is this model applicable? I chose this model because it is an effective empowerment strategy to use activity-related affect as well as interpersonal and situational influences as a means of facilitating and enhancing a health-promoting behaviors. Health promotion and education plan. The ultimate goal being of decrease obesity. The goal to decrease obesity prevalence at the high school in Birmingham, Alabama, by having the students implement the regular physical activity, as well as be able to identify and consume healthy food options. The education plan consists of educating the students on the effects of unhealthy eating, teaching the students the recommended portion sizes for each food group, educating on the importance of incorporating physical activity into their daily regimen towards their health and longevity. Research and evidence shows that childhood obesity has increased 8-fold since 1975. Incorporating community-based frameworks may increase the efficacy of school-based intervention programs to reduce obesity. Pre- and primary school children who are overweight and obese are more likely to continue to be obese as adolescents and adults, as well as stand at an increased risk for poor health outcomes associated with excess weight. Such conditions related to obesity include asthma, diabetes, cardiovascular disease, and sleep apnea. Cardiovascular disease risk factors in the form of elevated total cholesterol, triglycerides, insulin levels, and increased blood pressures were found in 60% of obese children aged 5 to 10 years of age. Evaluation. An evaluation would be performed by students being able to name a minimum of one disease unhealthy eating can cause later on in life. Students will be able to correctly identify the recommended portion sizes for each food group, as well as students will be able to log a minimum of 5 hours of physical activity performed after school by the end of the week. In conclusion, there is a need to move fast, as already moderate overweight before the start of puberty is associated with significantly increased risk for type 2 diabetes and cardiovascular disease in midlife. These are my references, and thank you for watching my presentation.